Hormonal methods, the pill, the birth control pills, the implants, the patches, okay, the injectable contraceptive. Okay, fertility awareness method. This one basically fertility awareness method. Understanding the really the or having the reproduction knowledge, reproductive knowledge. Okay. Therefore, when the wife and the husband have this knowledge, they can plan effectively. All right. Abortion. So this abortion, spontaneous abortion, miscarriage, or abortion meaning the same meaning is miscarriage. It can be spontaneous, and it can be induced abortion. Okay, spontaneous abortion is due to many complication of pregnancy. Okay, or any problem with the fetus. Okay, complication, natural or spontaneous abortion due to complication of pregnancy, due to some abnormality of the hormones of the fetus, of the uterine itself. Okay. Another one, chemically induced abortion. So this chemically induced chemically induced abortion. So this RU486. This is also a pills. Okay. So this is what we call emergency pills. Okay. Iwani nak tanya ke? Ada Iwani on mic? Tak ada Kalau nak tanya terus terus angkat tangan ke atau terus unmute your mic. Okay. Okay, so this one, emergency pills. Again, what do you think contain in these emergency pills? Ada apa agaknya? Ada drugs apa that can induce abortion? Siapa agak-agak boleh give suggestion, or even you can search the facts. What contain in these emergency pills? Anyone? Cuba cari. Okay, emergency pills, RU486. Haira ke? Fatin ke?
Ya, ke anti-progestogen.
Anti-progestin.
Lebih kurang macam tu lah.
Anti mean antagonist antagonistic.
Saya search, dia keluar progestin hormone called levonorgestrel.
Okay, progestin hormone. Okay. Mifrex awak cari Mifrex atau RU486, right? Okay, so now we know whether it contain anti-progestin or progestin hormone. So it basically is progesterone. So let's try to understand how these pills will induce abortion. Okay, so I have a case study. I think this is last semester. Okay, contohnya, a sexual assault victim A is taken to hospital for evidence collection after 24 hours of the incident. The medical officer was informed that the victim is in 3 to 4 days prior to ovulation. Okay, the medical officer then advises her to take emergency contraceptive pills to help prevent the pregnancy. If you are a medical officer, explain to her how do the pills could prevent the pregnancy. 8 marks over here. Okay, so how to explain here. Okay, you have to include you have to relate to her this concept here, 3 to 4 days prior to ovulation, and the intercourse is has taking place. Okay, has took place, and she is 3 to 4 days prior to ovulation, so the higher chance of getting pregnant, right? So by taking this, so You have to explain that, and then you have to explain this emergency contraceptive drug contain. Okay, what is the hormonal atau drug yang involved lah. And then you have to explain to her this hormone or the pills will manipulate ataupun what happen if she take this hormone. Okay, sebelum kita tengok lah apa benda tu So emergency contraceptive pills increases the progesterone level in blood. Okay, so just now we know that these pills have progesterone level. Progesterone. So when this sexual assault victim took these pills that have high progesterone, it will give a negative effect to the anterior pituitary and also the hypothalamus. Okay. Therefore, it will automatically suppress the FSH. Okay. So the follicles development or the follicles that undergo the development will suddenly have no signal to develop more. Okay, therefore no Graafian follicle. Okay, the absence of follicles development or the absence of Graafian follicle or the most matured follicle will inhibit the positive feedback of LH. Okay, therefore no ovulation will occur. So this is how you want to explain this example of case study over here. So you have to relate your understanding of the hormonal regulation, and you have to know the pills contain what hormones. Okay. So another one, the contraceptive pills can also thinning the lining of the uterus. Okay. Why? Because these pills were taken at day, macam mana tu ni? Ni kosong, ni hari ke-14, ni hari ke-28. So it's between these days here. Okay, the sexual assault occur. So shouldn't the progesterone shouldn't be so high at this period over here. If it's suddenly high progesterone here, it will inhibit the follicle development in this region. And also if you go back to the if you go back to this this diagram over here, okay, at this stage, 3 to 4 days prior to ovulation, over here it's a proliferative phase. This proliferative phase of the endometrium wall is due to the estrogen level, right? So if progesterone is suddenly high, it gives the negative feedback to this region. Suddenly FSH also low and LH also low. This estrogen will not be will also drop. Therefore, the proliferative phase of the endometrium will disrupted or disturbed. Okay. So yeah, so that's how you want to explain this case study example. Okay. So tadi kita cakap pasal birth control, I mean the emergency pill. Okay, this one. Okay, next. So this is the explanation of each of the birth control pills, over 40 different types, although dosage of hormones are different, all work the same way. It will block the Graafian follicle development. Agaknya kenapa tadi saya dah cuba terangkan, so you have to relate back. So this is also a keywords to explain to the case study just now that I show you. Okay. So no ovulation occur because no Graafian follicle, present. Okay. No egg, no fertilization. So it will reduce the endometrium development. Okay, ni yang thinning tadi lah. Whichever term you try to use, as long as the the meaning is there, you can get marks. Okay. You want to use thinning of endometrium or reduce the endometrium development, is the same meaning. Okay. Combination of estrogen, progestin, sometimes progestin only inhibit ovulation. Ni semua dah ada. Okay, maybe we can talk about this one. Thicken the cervical mucus. Okay, in previous chapter fertilization, we know that one way of determining ovulating women is due to the cervix mucus, mucus. So again, this relate with this cycle over here. This one we know this region estrogen and this region progesterone. Okay, so cervix mucus at this progesterone phase here and then continue to the early phase of here. Okay, the cervix mucus is thick. Okay, but as estrogen rise, it will become watery. So this watery cervix mucus support sperm transportation or sperm journey. Okay, so by taking progestin or by taking this birth control and having this progestin or combination of estrogen, okay, later we'll talk about this, especially the progestin, it will thicken the cervical mucus. Therefore, it will inhibit the sperm journey. Okay, so it will help in terms of controlling the birth. Changes the lining of the uterus ni, I think you faham kenapa macam dia change. Okay, inhibit, changes the lining of the uterus to inhibit implantation. Okay. Okay, in terms of this, our the women, our endometrium, okay, need to be exposed to estrogen first and then followed by progesterone. Then it will have the thickening and thinning, the thickening of the proliferative and secretory phase, the normal cycle. If suddenly the endometrium exposed by progesterone without exposed to estrogen, it will not help the endometrium or the uterine wall to be develop thickening develop or thickening of the endometrium at normal cycle. Okay, same thing occur with cervical mucus. Okay, let's say the cervix region or the reproductive female part exposed to progesterone only, the cycle of the cell for endometrium and or even for the secretion of the cervix mucus will not occur normally, where the normal situation is exposed to progesterone and then estrogen and then back to progesterone. Okay, so it will the cervix mucus will thicken and then watery and then we come back to thicken cervix mucus. Okay. This one is a deeper explanation of at cellular level or at tissue level how the hormonal interaction with interact with the tissue of the endometrium and also the cervix mucus. Okay, ada je dalam buku Martin tu. Okay, and even any reproductive reference book. Okay, okay, this one. This is side effect of birth control pill. Ini boleh baca sendirilah. Changes in menstrual flow. So ni saya rasa if you understand the cycle, the days over just now, you will understand how it change the menstrual flow. Okay, and also it will give breast tenderness. Okay, nausea, vomiting, weight gain. Yeah, usually observe this weight gain. Aches. Okay, aches. Okay lah, ini semua adalah adalah side effect. I think it's a general knowledge to read. Okay. Next, implant. So this is an implant example. So it looks like this subdermal implant. So in this subdermal implant contain this progesterone or this hormone over here. Again, it will affect the hormonal regulation of the female reproductive system. Okay. The effect is preventing the ovulation. So you faham macam mana, okay? More effective than pills. Why? Why is it more effective than pills? Because this implant devices, okay, it's already implanted in the subdermal under the skin. So it will the progesterone level at plus in the body will keep at high level. Okay. Kalau makan pill, the birth control pills here, these pills will need to be taken like every morning, meaning it need a discipline people or discipline person to take this approach. If she is a forgetful person, she might want to use this approach implant. Okay. All right. Yes, Ikram raise hand.
Madam,
Yep.
Miss, dia punya side effect tu kan, ambil masa berapa lama maksudnya?
Okay, berapa lama tu depend pada body lah. If at early phase, when the body suddenly have this progesterone, high progesterone, so this is abnormal. High progesterone at all time, so it's an abnormal situation, right? So the body will condition first. If kata berapa lama, mungkinlah sebulan, ini depend pada orang, okay? Depend, mungkin seminggu 2 minggu ataupun mungkin dah masa seminggu. Kalau dah masuk 2 minggu sampai sebulan tu, if masih vomiting, nausea, maksudnya dia tak sesuai lah. This lady tak sesuai lah nak ambil. Saya ada experience observing my friend, my colleagues, dia bukan birth control pills, dia taken hormone for assisted ART untuk buat IVF lah contoh. Okay. So IVF, kalau siapa nak undergo IVF pun, this the wife will be administered with hormone, right? So taking hormone exogenously is something abnormal kan. So badan dia dah biasa cycle yang macam mana lah, dah akan level hormon yang macam mana. So bila suddenly we take extra high concentration of hormone, so the body will react by this, okay, nausea, vomiting. It should be most like one week, okay lah kot. Kalau lebih tu maksudnya dia tak sesuai. But weight gain here, I did observe one of my friends, okay, that took birth control pills, okay, and she did gain weight, okay. When we talk about it, she did gain weight, and then when she removed these birth control pills, in order to get pregnant again, she lose weight. Okay. So menjawab untuk soalan Ikram tu bergantung pada orang, tapi selalunya weight gain ni memang obvious lah. Vomiting dengan nausea ni kalau berterusan maksudnya dia tak sesuai. Dia akan ambil cara lain lah. Tapi doktor mungkin akan kurangkan dos lah, so that determine again to the person body condition. Okay. How many dose to be taken. Boleh ke Ikram? Adakah membantu kefahaman?
Thank you Miss. Lagi satu Miss, saya
Yes.
macam tak ada lah macam nak cakap. Dia macam dulu ada makcik saya ni dia makan pil. Dia consume pil ni. Lepas tu nenek saya dia macam bebel. Dia kata nanti boleh merosakkan rahim.
Oh, merosakkan rahim.
Because dia dah macam ni, makcik saya tu dia consume ni macam sebab dia nak delay dia punya pregnancy, dia tak nak
Yes.
pregnant dulu. So dia dalam 3 or 4 months macam tu dia consume. Lepas tu nenek saya tu. So maksudnya apa yang nenek
Okay.
saya cakap tu mitos, macam nak cakap, benda yang tak betul ke apa?
Dia memang akan bukanlah efek rahim. Efek rahim tu maksudnya rahim tu tak jadi normal. Dia tak akan ada thickening and then thinning. So menstrual cycle tu absent terus. So in terms of dinding endometrium ataupun rahim tu, kita manipulate the hormone kan. So the uterine wall ataupun rahim tu dia tak proliferate dan tu. Tapi bila kita remove saja birth control pills, it will go back to normal lah. So nak kata
Oh maksudnya dia tak adalah macam kalau kita, bukan kita lah, maksudnya perempuan tu consume birth pill ni, birth control pill ni, contoh like 4 months ke 5 months and then next month dia dah ready untuk pregnant, so okay lah, dia tak ada effect apa kan?
bila tak ada effect apa-apa. Dia bila remove je body akan conditioning balik, tengok hormon progesteron tu akan rendah. Bila progesteron rendah, suddenly GnRH akan high and then FSH/LH akan high and then FSH/LH akan high, ovary akan start develop follicular development and the endometrium starting to bila follicular growth happening, estrogen akan high balik kan. Estrogen akan start stimulate the thickening, the proliferative phase of the endometrium. So dia nak cakapnya untuk soalan Ikram tu in terms of statement nenek Ikram tu, itu mitos lah. Dia tak akan rosakkan rahim yang macam tiba-tiba dah tak boleh thicken, tak boleh tak ada baby dah lepas tu, tak. Tapi dia the birth control pill did influence the endometrium process. Normal process lah. Patutnya endometrium akan ada thicken and thinning. Thicken and slot off. Due to hormonal regulation, estrogen high and then drop and then progesterone and then drop ada period. Sebab patutnya normal macam tu. And then so dia in birth control pill akan effect macam tu. Tapi tak, it's a mitos kalau dia rosakkan rahim langsung. I think it's a mitos lah. But again, we need to read more lah and really seek for the gynae lah untuk soalan. Kalau sepaham saya konsep yang kita faham ni, birth control pills is only manipulating the natural process of endometrium proliferate. Yeah. Okay.
Thank you Miss.
Alright. Good question. So good discussion that we have. Next. Saya rasa ini implant. Ini implant utilai. So you faham implant is like these devices being implanted under the skin. Okay. So these devices have this hormone also present with this hormone. Okay Amira, tak apa Amira. Thank you Zuhada. So ni ada yang kawan-kawan bagi example of brand name combination pills. Okay. So this is brand name combination pills. Okay, next. Thank you Aira, thank you Suhada. Ni ini boleh ni lah, so kita go to yang major things so ni contradiction, contraindication, this one might be give effect this one, okay. Liver disease, breast cancer, cardiovascular disease. Liver disease kenapa? Liver adalah organ yang organ pembersih. Dia akan bersihkan darah kita. Apa yang kita makan, kalau kita ambil suplemen, benda-benda yang synthetic drugs ataupun apa-apa yang tak perlu, first dia akan digest. Badan kita akan ambil apa yang nak. So dalam darah yang terima macam kita makan antibiotik, eventually masuk darah kan, ataupun any drugs. So eventually the liver will cleanse the blood system. Okay. So if we take a lot of synthetic drugs, the liver need to work hard and work more. Okay. Kalau tak perlu, tak payah makan.
Miss,
Fatin, yes.
Alanya kalau yang contohnya yang macam yang dekat drugstore ke atau mana supplement contoh dia vitamin C yang kita perlukan yang supplement kan antara 75 ke 95 miligram macam tu. Limit
Betul.
dose dia dalam 1000 ke 2000 miligram macam tu lah kan.
1000.
Ah,
Saya
1000.
1000.
Kalau orang tu consume vitamin C for 6 months for every day, bukan nanti dia akan macam akan ada lebih. So nanti bukan hati kita kena work harder lah kan untuk dia ni toksikkan yang vitamin
Betul lah, dia akan work harder, tapi vitamin C is macam mana vitamin C ini kena cakap dengan nutrition juga saya pun tak berapa je lah. Vitamin C is essential in our body, tapi kalau kita makan consume vitamin C banyak, memang sebenarnya vitamin C tu badan kita akan ambil yang mana nak je. Yang selebihnya memang liver and kidney akan buang. Sebaiknya kita ambil vitamin C guna fruits lah, from the fruits. Tapi again, why do modern people have to take supplement? I guess the lifestyle or the environment of modern days also give effect or influence how our body system coping with pollution, coping with many instant food kan. So sometimes perlu juga ambil suplemen, tapi kita jangan jadi macam obses dengan suplemen lah. Sebaiknya seek for the medical doctor whether do I need to take this, do I need to take that, macam tu. Itu pendapat saya lah. Itu pendapat saya, dan so far kalau saya share dengan awak, saya tak, so far saya umur dah dekat 30 lebih, dah dekat 40 ni. Saya tak ada ambil suplemen. Contoh kalau the ladies ambil Primrose adalah macam-macam lah, Primrose ke apa benda kan. Cuma lately ni saya ambil vitamin C je lah, sebab due to ni lah COVID and coldness, the flu and the coldness. Vitamin C is I don't know how to say it, substances or an army for our immune body system. So maksudnya dia adalah penambah atau immune booster lah, macam tu. So tapi saya tak ambil dah banyak. Macam mana? Again lah, if we talk about liver disease lah, but again we know that liver is the cleanser of the blood. Itu je lah. Tapi kalau you nak tahu ni, kita kena baca lagi dan seek for the expert. The expert meaning really the nutritional or the medical doctor in terms of this drug. Sekejap. Okay, boleh Hopefully this discussion opens up the views and then boleh bantulah dalam appreciate life lah, especially. Okay Fatin?
Okay, Miss.
Okay, let's move to the next slide. So this is an example injectable contraceptive. So macam ni lah, macam kita ambil jabs lah. So dalam tu ada progesterone, okay. Side effect, sama juga ada spotting. Spotting ni like a blood spot lah. Weight gain, headaches, dizziness, okay. Similar to pill in all aspects.